Hey guys, this is your lead practice and educated nurse T Era coming to you live with another great video. Good morning to all you queens and kings out there. Welcome to my channel. Please subscribe. I'm going to put up some awesome content, some topics we need to talk about, okay? And some fashion tips and why and this and all that stuff like that. A quick update, I am currently an RN student, but I'm at the end of my program, so that's going to influence my content at this point. I've been going to post some things from prior that I have went through. I am currently in med search 2. I have acute care, then my preceptorship start, guys, so yay for me. I've seen some really cute videos out there for what's in my clinical bag, and they bags are so full, and I'm like, I can't carry all that stuff, and I'll tell you why I don't carry all that stuff. But anyway, I'm a tote kind of girl. When it comes to bags, that's the bag I like. I like the bag. You can throw everything up in there and run out the door. Some mornings is going to be like that. I have to be at the hospital for 12 hours. I have to be there at 6:30 a.m. And where I live, it's going to take me over 30 minutes or 45, sometimes an hour and a half to get to my clinical rotations to the hospital. And let me tell you, when it's 4 o'clock in the morning, you're up trying to be quiet because you may have kids sleeping or boyfriend or husband, and you don't want to disturb nobody, and you're trying to grab your bag in the dark. It's best to prepare for clinicals the night before. I have 2 bags, guys. Maybe this is helpful for someone else. I have a lecture bag, so when I run out the door for class, I grab my lecture bag that's already packed with all my lecture things in it, and I have this clinical bag. This is used for my clinicals and my labs. It's called SIMS. So when we have SIMS or lab or clinical, this is the bag for this girl, and it's already pre-packed with the things that I use for clinicals or SIMS or lab. So anyway, so this bag, guys, is cute. I think I paid like $5. No, honestly, I'm from New York, and that's how much it was, like $5. It says New York on it. I love the colors. Like I said, I don't like the ones with all the outside pockets and all that stuff because I just know me. Like, I probably will lose something, and I always tend to forget something crazy, like a badge or a pen. I'm one of those students. Like, I am not a morning person. But anyway, so let's talk about what's in it. So what's in this beautiful bag? So let's start out opening it. Now, I would say be mindful when you have your bag or whatever cute bag you may see before you start nursing school and you going shopping and you thinking about all this beautiful stuff. When you're at the hospital, sometimes you don't have nowhere to put your stuff. So be mindful of the size bag that you have because it may not fit. A lot of my classmates struggle with that because they have these big old Barney bags with all this crap in it. And no daggone well, we don't use that. Once you're on the floor, you're on your floor and you're working. You're not going to have time to be coming in your bag 10 times. So just be mindful of size, guys. Be mindful that the hospital is a germy place. So please don't have your Gucci bag in the hospital where all the germs and stuff is at. I mean, unless you're literally wiping every piece down of your bag, wiping it down with your wipes. Most likely you're probably not because you're going to be tired by the time you get home from clinical. So don't have your best at these hospitals. Get something that just goes with you to that place. So this is always the bag I use when I go to the hospital. So anyway, let's talk about what's in it. So let's start with my iPad. Now, my school's accelerating program, we don't get regular books, we get ebooks. And this is what they gave us, an iPad. Regular iPad, you know. So all my ebooks is on there. Reason why I bring this is just because sometimes these instructors, y'all, they be extra. They want you to, oh, give me 5 diagnoses, come up with a care plan, or asking questions about certain things. And sometimes you just want to go home. You're so tired you can't even think straight. I have my stuff right here. If I need to pull up something for our portal or our Canvas, I just pull it up on my iPad. I like to have it. It's easy to carry around and hide it in there. Sometimes I do not, depending on what hospital I'm going to. If it's in a certain community, this iPad stays in my car and it hides under my seat in my car. If I feel like somebody may be going through my stuff, you know, just never know at a hospital. So that's one of the things that's in my bag. Another thing that's in my bag is this little cute little water bottle. Now, I am not big on drinking water, I'm going to be honest. But this I got from TJ Maxx. It's called Hydra Peak. And this keeps your drink cold for a very long time. So I'm the type of girl that might do a Monster and then like have something really cold to drink. And I like it cold. So I paid $12 for this. I just went to TJ Maxx instead of paying $60 for a water bottle. Like, it's a good size. The only downfall about this water bottle is it doesn't fit in your cup holder in my cup holder in my truck. So I just toss it in my baby's car seat. And then sometimes I forget that is in there. And then when I go to clinicals, I don't have nothing to drink. Sometimes that happens too. But anyway, that's my water bottle. Next will be my stethoscope. Now let's talk stethoscope. This is the Lemon. It's a class 3. I love the color, guys. In labor delivery, they had these little itsy bitsy babies that was just born. And the cool thing about my stethoscope is 2-in-1. So literally, it's the newborn size, the adult size. So the P's, newborn, adults. All you do is turn it like that and put it in your ear. And I always tap to make sure that is on the right side. I literally used this on my baby. He was less than 24 years old. And when you're doing vitals on babies, you have to do everything for 1 minute. So yes, this baby came in handy. Now guys, when I went to get a stethoscope, I didn't even want to buy a stethoscope. I wanted to wait till after I got out of school so I knew exactly which one I wanted to buy. But my school said we had to get our own because at the hospital you had to have your own. So I went to just a local nurse and scrub store, and I literally used every last one of them. Like I was listening to my daughter, like, come here, let me see. And some of the cheaper ones are actually really, really, really good. But you may not pick up on murmurs or anything like that, or, you know, certain sounds. But you can hear, like, the basic things. As a student, you just looking at basic things at this point. But this was really good. I think it was, like, $150. I got a little discount because I go to the local store all the time. I always go to those because they keep you in the system. They know you. So they kind of, like, you know. And, yeah, they made sure I had the best when I walked out. So I always need my stethoscope. Now, guys, we're not allowed to walk around on clinicals with a stethoscope like this. They consider that very germy. So I would say if you buy a stethoscope, make sure it's something that is very flexible, that can kind of like fold up like this and go on the side of your scrubs or whatever. So that's how we carry our stethoscope around, and wipe it down when you use it. You're going from patient to patient. I scrub my equipment down. Like as soon as I come out that room, purple top wipe, wipe it down my stuff. Next would be my laptop. Now, all the time, I don't keep it in here sometimes because I don't want to like break my toe, you know, but I have a cute little laptop, holder that I put my laptop in. Now, after my first couple of days of clinical, I know how my instructor is, and maybe she like give us some time to work on care plans. I will bring my laptop because sometimes you may not have access to the EMR at the computer at the hospital, or it's just not enough computers for students because of course the staff is using it. So this is a mini size laptop though. It's not even like the big laptops, and I pay like $300 or something like that at Walmart, whatever, like Christmas. So yeah, it's a Dell. Love it. I do all my care plans on there. Another thing I have is this beautiful little bag, and what I do is, and I just started doing this probably like 2 terms ago, I have my main things in here so I don't forget. So scissors, and I use this a lot now in med-surg because med-surg have like more wound cares and like packages that is so stubborn. You be sitting there trying to be cute, like scanning your medication, because you got to scan your patient's band, and then you got to scan all your medications and packages and stuff that you take out the supply room, and then you're trying to open it, and then it's like you're trying to be cute at the same time people watching you, and it's just not opening. Scissors. And I just did like some honeycomb dressings like literally this weekend because a lot of the patients are coming out of surgery or whatever, so the scissors are great because you want precise size dressings, you know, so you want things to look cute and neat. These scissors come in handy, but again, wipe your equipment down. And these were like, I think my LPN program gave me these or whatever, but you get these for like $5, $10 on Amazon. And yeah, I think I'm gonna get the all black ones. Next, this goes everywhere I go for my hair. Now, I just cut my hair, guys. Yes, I did. It's a little cut because my hair is very thick and is long, and my school was very, very, very strict on hair. I always get in trouble for hair because I always switch my style up every turn. I may have dreads, I may have braids, my hair may be up, may be down. So when I have clinicals though, I don't like using the rubber bands or things like scrunchie, stuff like that, because I like my hair to be straight. Like soon as I leave clinicals, I'm the type of student that boom, and that hair comes down, and I'm like, yes, baby, and I'm trying to look like myself before I leave there. So yes, so this is better because literally if I'm running late or whatever and I'm getting ready to go and sign into the hospital, I just put it up like that and clip, And I have to wear white scrubs, and I feel like this matches pretty good. And I just went to my local beauty supply store. It has a little bling on there, so it was cute. Paid like a couple of dollars. Next thing is Penlight. I haven't used my Penlight, I want to say, since fundamentals. Now, fundamentals, or I'm trying to think when we learned our head to toe. But when you start doing head to toe, you better have this Penlight, okay? So yeah, you use your Penlight stuff for your pubes. You know, you may use it for something else, like if you suspect some lesions in the mouth or something in the ear, but I really use this. But yes, gum, guys. Now, gum, you're gonna need some type of gums or mints if you're doing it a long, a couple of hours in the hospital. It's just something about the hospital just makes you very dry. Your mouth be all dry. You be dry, you be ready to go. Skin dry. The hospital is just a very dry place. Now, it's unprofessional to chew gum, like, in uniform, like you just, but when you have a little break and you go to break room, pop some gum in your mouth, and I tell you, it just helps get the juices going in there, and, everything feels fresh again. And usually somebody's going to ask you for gum, so I always try to keep some for my classmates, too. So that's what I keep in there. Another thing is I keep a backup watch, guys, because, thank you. It's my 2-year-old, because it's best to have a second-hand watch. I always have my Series 3 Apple Watch, but sometimes your girl don't be charging up her watch, and guess what? I'm at 0 balance by the time I leave this house 4 o'clock in the morning, and my husband be mad at me, but I'd be like, oh, I just forgot. So I always have a backup second-hand watch. It doesn't have to be nothing fancy. I think I went to, like, what is that store, Claire's or whatever, where they sell the little cheap jewelry or whatever, and got this one. I love rose gold and things like that, so it was like a really cute watch, Oh yeah, it tells you I got it from in the back, so I think it's cute because it goes with all my scrubs. This is also a scrub top, if you was wondering. Yes, scrub top. Last thing in that pouch is definitely this poke socks. This was life-saving, guys. When we were in fundamentals, we started our first couple of clinicals. None of my classmates could get signed off if I didn't have mine. I was the only one who had this, and I shared it with everybody. Of course, that was nice, but this was a lifesaver. Everybody was using it. Make sure you wipe it down. It gives you your oxygen levels. You turn it on. You press the button. You put their finger in there, and it gives you oxygen level, and it gives you heart rate automatically. Now, if their hands are cold, or they have long nails, that may interfere with you getting a good reading. I like to not use the hand that I'm doing blood pressure on. I do the opposite hand. That's another thing. Or I like to warm them up if they're cold. Stop. Sorry, guys. That's my 2-year-old. Anyway, so this you can get online. Well, I went to Walmart and bought it. It was like $10, and it came with a little case, and it goes around your neck. So when I first started clinicals, I thought I was doing something because I have my own post-ox. Because in the nursing home, they do not have all these equipment. So you just have to be mindful of that. But as you go to the hospital, like, they're going to have everything. So now I don't use it, but in the beginning I did. Last but not least, I keep in my little pouch is sugar. Now, I know this is weird, but sometimes in the hospital, they may have the coffee, but they may not have no cream or sugar. And I cannot drink that without no sugar or cream. So I keep my own little hidden packages in here. Sometimes I keep skin prep in here. And this is the little bag that I go through when I get to the floor and I sign in with my instructor, get my assignments. In my nurse that I'm with for the day, I will literally start putting my stuff on my scrubs. I try not to leave the house and just put stuff in my pockets already and then get in my car and drive and then something fall out my pocket. I wait till I get there, hear my assignments and what I got to do for the day before I prepare. So I'm like, okay, I definitely know I need my stethoscope, definitely know I may need a Penlight, So that's how I do it, but you can do it differently. My way is not the right way all the time. So that's what's in that little pouch. Now, and I keep my stethoscope in here. And that keeps my stethoscope from getting damaged. Now, some people got some really cool, like, stethoscope holders that's, like, really big and cute. Like, like I said, this was like a makeup bag or something like that. You could use little cute bags that you have and just put your stuff in there. So you don't want your $150 stethoscope to get damaged or, the color start to peel off or something or whatever. Like, you want to keep something, in your bag So anyway, next, this, guys, not the glove, sorry, but this is a pocket guide for RNs. Let me tell you how many times this has saved my life, especially in my peds rotations, labor delivery, the specialties, when I forget like certain lab values or certain like vital signs for kids and all the different milestones and all that stuff, or it's an emergency and my instructor's like, hey, I need you to do this, or I need you to know this, and I'm like, this could fit in any pocket. I had it for like 5 years now. When I was first started RN out, it's a lifesaver. I use it a lot in RN school now. I use it a lot in Sims. Like, it has every category from procedures, vital signs, assessments, like what to assess, how to convert your temperatures, because a lot of times we got that in Sims, like they just give us the Celsius and don't give us the Fahrenheit. Like, really, we gotta stand here and figure it out. But anyway, it tells you the cuff size, and it tells you IV. Now in med-surg, you do a lot of IVs. You may be able to start an IV. You're going to be piggybacking your IV medications. You're going to be hanging your IVs and priming your tubings and all that great stuff. Yes. So sometimes you just want to make sure you know that normal saline goes with all the other IV medications, because sometimes the patient may be on like 3 antibiotics or something like that, and you want to make sure like they're compatible before your nurse be like, yeah, just hang it, and you like, you always, if you have that feeling in your stomach that says, who pours, let me look this up, look it up. You are a student RN, even though you don't work there, you are responsible for your patients still. So you need to make sure your nurse is giving you the right instructions, and you're like, hey, wait, let me time out, let me make sure this is right. Yes, so this has labs. When you're doing your analysis, it has emergencies, it has EKG, because telemetry monitors are everywhere on the med-surg floor, and literally a lot of the patients are on it. So you want to just watch their strip as it's going on, looking at their waves, making sure everything is normal. It tells you if somebody's choking, what to do, all your emergency meds like dopamine, epinephrine, nitroglycerin, things like that. It tells you all the baby stuff was amazing. I didn't know RNs do, like in labor delivery, I didn't know like they do pelvic exams, but apparently they do. I worked the triage part of it, so yeah, like I learned so much. We do boluses and everything. So, and in peds, I just went to this page and was like, okay, point at the face, you know, that is appropriate for you. You said you're in pain, so you're not crying, so you got to be in the middle, like, you know. So this book was helpful. But I don't remember how much I paid for it, but I did went to a bookstore. I'm not the type to shop online, so I like to see my stuff before I buy it. So yeah, go on Amazon or whatever and just get the updated version. And it's by Mosley, and it's amazing. It's I have the 3rd edition, so I'm sure it's like maybe the 10th edition by now, but it's all the same standard information. And it came in handy, guys. Like, this thing came in handy. So like, I don't carry like a whole bunch of textbooks to clinical. Like, this is what I use, or they let you Google it. So I trust that book. Another thing that I carry is my medication book. This is a 2019 one, drug book. I use this more in Sims than I do in clinical, because when you're doing your med pass, and yes, you will be able to help do the pass meds, and you're going to be going into Pixis, you know, with the nurse and pulling your drugs and giving your medications. The computer pulls up your meds for you and will tell you about your medication. I had one medication that I didn't know that we wanted to look up prior to me giving it, because you need to tell your patient what you're giving before giving it. So anyway, this is a cute little book. I love the David Strux books, but they're too big to carry to school, but I use those for my care plan, and I have this with me when I go to clinicals and lab. I use this a lot in Sims. When I have a Sims, most of our Sims now are all complicated cases, and they all mostly dying. We have to bring them back to life. I don't know why they do that to us, but anyway, I'm type A. I like to look up my drugs prior to me getting my case information. Like, if I'm getting my case information and they're giving us a little break, I'll look up my drugs first, look for any patient teaching, if it interacts with anything, what is the protocol in if it's going to drop the blood pressure, so I need to be mindful of that. So like, I had one situation for labor delivery where the mom bled out, so I had to give a certain medication to stop the bleeding, or to try to help stop the bleeding, and it dropped her blood pressure even more if I would have gave it. Another scenario, like the recent Sims that I had, was for heart failure, and we was given certain amount of fluids at a certain level. Doctor ordered, but the protocol he had me to give it, like run it, was beyond. But it's supposed to be between 50 and 75 mLs an hour, but I think he wanted me to give like 100 mLs an hour, and I'm like, that's too much for this heart failure patient. Like, I recommend that you give me something lower than that. So yeah, that's what RNs do now. You recommend things. Hey. But anyway, I use this a lot in Sims, and I paid $20. I went to Barnes & Noble, so that's that. Anyway, what else I have in here? This, guys. Now, I know this is so simple, but this was like a lifesaver to my whole class, because I was the only one who had one in the beginning. Like, we have a lot of checklists and all this stuff that we have to bring with us every clinicals, and that they have to sign off at the end of the day, and sometimes they sign in the wrong spot or whatever. And so, like, yes, so I want my paperwork neat, so like everybody was using it. I went to Rite Aid and got like 2 in a pack, so like that's what's helpful. Another thing is aspirin. You're probably going to get your period while you're at clinicals, or you're probably going to get a headache because you drink too much coffee or you dehydrated. So always keep some medication on deck. Follow policy as far as what you can have. Maybe you can have Tylenol. Maybe they don't allow certain medications for you to carry with you in the facility. But I tell you this, you're probably going to have a headache. You're probably going to have a migraine. Your probably stomach going to hurt. Probably something. There's always something going on while you're on clinicals. So have your stuff in your bag, and just, you don't got to tell everybody what you're doing. Go in the bathroom, take what you need to take, and get yourself together. So yes, that just happened to me. This clinical, I was cramping, and I'm like, oh, my thing is coming. Like, why today? I got all white on. So anyway, I was prepared, because I always carry emergency pads. Your girl always have emergency pads. And then just in case my classmates may, you know, have an unexpected leak down there, I always carry this in all of my bags, my lecture bag and my clinical bag, because you just never know. Anyway, next would be Vaseline. This is what I carry. I do not try to get fancy with lipstick and all of that, like all these girls with a whole bunch of makeup kit. You would not have the time to have that makeup on, or you ain't gonna be able to see, because you driving 4 or 5 o'clock in the morning trying to get to a hospital. So I do everything that I need to do for beauty wise before I leave my house. And I may keep some Vaseline on deck, because sometimes your lip may get dry. Like I said, hospitals are a very dry place. But the thing about it is, you know, it doesn't last long, because you're constantly talking to your patients. You're constantly drinking something. So it's just like constant put on. Now, if you one of them girls that constantly just, then hey, keep your Vaseline on deck. I like Vaseline because it's Vaseline. I don't want to put colors on my face or something, and it, you know, smudges on my white scrubs. Anyway, so that's why. Another thing is I have a whole bunch of pens and highlighters. Now, I would suggest, if you're at the end of your program like me, please carry a Sharpie. You have to update your whiteboards when you go into the room. And I always be looking for this daggone Sharpie, and the nurses never know where it's at. So I'm going to like get a whole pack of them. I don't have any, but I always keep highlighters and like pencils. I'll always keep a pencil if I'm like writing something down that I, you know, want to erase. And when I take my notes, when I go to huddle in the morning, like to get my assignments and stuff, I just bring loose leaf paper, and I'm going to show you what I do. So when I get in my assignment, usually how it goes is you go into the building, meet up with your instructor, sign in, and you go straight to the floor. They're going to tell you who you're working with, and they're going to tell you the room numbers you're assigned to. There you go with your nurse. You grab your paper, whatever you're writing your notes on, and you're going to go bedside with her and the other nurse she's giving bedside report to, and you're going to write your own bedside report down on your piece of paper. But what I do is I don't like carrying a whole bunch of stuff on the floor, because you're going to room to room to room. I just take literally a sheet of paper, and usually if it's med-surg, the nurse is going to have like 6 patients, so you have 6 patients, and I will fold this into 6, and literally I'm writing just the important things down for that patient. I'm writing diet, because you want to know what the patient's supposed to be eating. You want to know if there's any protocols like falls or anything like that. You want to write down the recent vitals, or if the patient needed a blood sugar check, what was the glucose levels. You want to check. So basically you're writing the things you need to know that's going to help you on your shift down. When the last time the dressing has been changed, when was the last pain medication given, things like that. So you write it. I literally fold this paper, and I put it in my top pocket of my scrubs, and that's all I have for the day with 1 pen. I do not carry a whole bunch of stuff on the floor. I feel like it's going to fall out when you're really working like you're supposed to. You're just too busy to have all the stuff with you, and it's just going to be in a nursing station somewhere. Somebody's going to pick your stuff up. So I'm going to start buying all that fancy stuff once I'm working on my job, and I feel like I need it. But right now, I don't need it. This is my love folder. This is a folder that just have my schedule in it for class and clinical. And I start building on it from day one clinical. And so it's all my S bars in here, all up to date. I always keep an up to date NANDA diagnosis. You can get this online in print. They just up to date the diagnoses. And sometimes before you leave clinical, they want you to give 2 nursing diagnoses. So you can always just look at your updated list and just say, pick something that's appropriate, activity intolerance or something, you know. And this is up to date. I always keep this. I also keep a copy of a care plan that is going to be related to the patient that I had that day. And if I have 10 minutes on clinicals, I try to get into the computer and get the information and write it into the care plan already. So by the time I leave clinicals, my care plan will be literally filled out. Everything will be filled out. So when I get time to do the actual care plan, all I have to do is just type it up, add the medications, add the disease processes, and like put the care plan together. Another thing I have in here is like head to toe, like if you're assessing hearts and lung sounds, where to put your stethoscope, just things. Sometimes you're going to have instructors that come up with their own little packages that they feel like is very useful for you, that's going to be useful. And I hold on to all that great stuff because sometimes you ain't going to remember thousands of things. And then this is one package that one instructor gave us that just tells us where to put, you know, us when we listen to lung sounds and heart sounds, where to listen. So like, yeah, see, these will be your lung sounds. So it looks like that. It talks about terminology, the ends of drugs. So in case you come across a drug that you don't know, but you looked at the N is familiar, is in within that class. Talks about EKG, antidotes in case you overdose the patient or the patient has toxicity levels such as digoxin or like aspirin and stuff like that. Just gives you the antidote. I think this is super fly. These are the things I keep in my love folder. These come in very in handy when stuff hit the fan. I have braiding scales in here. I have your 12 cranial nerves, DSM-5 when I was doing mental health. Just things like that. Like each instructor, they give you a little something from them, and you want to hold on to that because it's gonna come in handy. So anyway, that's what's in my bag. I know this video took a little bit, but I wanted to give you an insight of literally what's in it. Now the only thing missing is a peanut butter jelly sandwich, some M&Ms, and a Monster maybe. I am a peanut butter sandwich girl. Every time I have clinicals, I make 1 or 2 of them. It's a lifesaver. That fiber of that peanut butter, it holds me over until we have lunch. Sometimes you don't have lunch till 1 o'clock and you've been in the hospital since 6:30. You don't want to be that student that's hungry, constantly begging for a break. And then you're going to be overspending your money. I always just make a peanut butter sandwich before I leave or the night before. And when I'm eating it on my way, and I always drink my cup of coffee on the way to the hospital. And so by the time I get to the hospital, I'm full. And so I can work for hours before I go to lunch and not be hungry. And I always keep M&Ms on deck because after lunch, let's say around 5 o'clock, you start to get a little snackish again. M&Ms are really a good way to eat something that nobody's really it's not noticeable. You know, you're not sitting there eating a whole bunch of chips or something and it gets all over you. M&Ms is a quick snack you just throw in your mouth. I'm an M&Ms queen. I love it because it just holds you. That the peanuts just helps. And I always have a cup of coffee. And I try to I drink all this stuff and eat all this stuff before I get to the hospital because you're not going to be able to sit there and eat. You're going to hit the floor as soon as you go in there. So you want to be mindful of that. So peanut butter sandwiches to me is easy to eat, so don't really get too messy or on my scrubs while I'm trying to drive, because sometimes I leave a little late or I don't feel like getting up. So yeah, it helps. Those are the only things missing from my bag, but thank you for watching. I hope this was super helpful. You're gonna have a bag that's probably gonna be different based off your experience or where you at in the program, but that's okay. Everybody bag probably look full, but sometimes they probably don't use everything that's in their bag. Everything that was in here is what I used. So if you have any questions, or you want to know where I got something from, or if I didn't say it in the video, please leave your request below. Please subscribe, guys. Thanks for watching.